I am joined in StartUp studio right now with Alexandra Greenhill, Dr. Greenhill, founder and CEO and Chief Medical Officer of Careteam. And you're working to solve the problem of fragmentation of care, focusing on some really tough chronic diseases, I understand. So we'll get into all of that, but I want to start by really understanding what's that big, audacious health moonshot that you're shooting for? What's that big problem that you're solving?
Well, the biggest problem is the gap between what we can do for patients today and what happens for the average patient is getting worse as opposed to better.
Okay.
And so we know better what kind of interventions make them feel better and get better, but we don't implement it because it's not easy to remember everything that has to be done in order for the patient to have the optimal experience.
Okay, so things are fragmented. Things are confusing, okay? So you are stepping in here as a navigator, kind of bringing that together. So talk to me about the actual product. How is Careteam solving that problem?
So the average patient who has a chronic health issue has seven health issues across a possible 200 common ones. And so think about it, between genetics, lifestyle, smoking, exercise, and other factors. If you have diabetes, you're likely to get renal failure or heart failure or cancer and other conditions. Yeah. And each one of them is massively complex. There's so many tests, appointments, treatments that have to happen. Yeah. And so our software essentially says, well, what if you actually had a clear plan of action that's personalized to you for each one of those diseases, but also combined across that tells you today, for your heart, do this, for your diabetes, do that. And it allows you as a patient to say, I need a tribe, I need a village of people to help me cope with this on the emotional level, on the logistical level, in sort of family members and friends that I choose to share this with who can step in and help.
That's interesting, you bring in the element of incorporating your village or tribe. What does that look like? How do you coordinate care with average people in your life, your family, your neighbors? What does that look like?
Well, that's why technology has to step in, because without it, it's just too difficult. And I've now been in practice for 20 years, and very little has changed for the patient in that amount of time. But we can book our trips and order food and online banking, and so it's time to make it possible for people to do that on their own, but backed through the medical system telling them what should be happening, and then letting them have the freedom of choice as to who gets involved. Nice. But we've made healthcare into a team sport. Okay. It's time to make patient care a team sport too.
Interesting. What does it look like if I'm using the platform and I've got a neighbor that I'd want to bring into my care team? I want to bring it all together into one platform. What does that look like in practice? Because that's kind of a foreign concept for me.
Well, it is, but right now people are doing it. They're using email, WhatsApp, Facebook. Okay. None of them are privacy enabled or compliant. And so through our software, the medical team gives you instructions, and then you decide as to, my brother and my siblings and my parents can have access to everything. They can see my entire story. But for the neighbor, I just want to tell them, can you please feed my cat while I'm away in the hospital, or pick up grandma?
And you can do that on the platform. You can get your neighbor involved in basic
but decide
care.
How much access they get to your medical history, because it's yours, it's private.
Interesting. What kinds of chronic diseases is this particularly useful for, or have you seen success in?
So startup health means we're still a startup, so getting going. And so far we've done dementia, heart failure, multiple sclerosis, epilepsy, diabetes, cancer, and eating disorders. And the platform's flexible and works across all of those. But essentially, anything that, for 6 to 12 months or longer, essentially massively impacts your life, gets better through collaboration, coordination, communication, because the plan always changes, but it's important to have a plan.
Got it. No, that makes perfect sense. So talk to me about kind of where you're at right now, what you're looking forward to in 2020. What should we be looking to see from Careteam?
Oh, it's exciting because in the healthcare system, everyone knows care pathways work. And right now they're done analog. They're done by hand, by case managers, by nurses, and we're helping digitize that experience. And it's really fascinating to see proactive clinical systems and decision makers saying, yes, we want this. Yeah. And so we're now starting to work with some of the best organizations across Canada and the US, Sweden, England, and others, saying that it doesn't matter how the healthcare system is structured and who pays, the problem's still the same. We have many new options to offer, good news. Yeah. However, they're not coordinated, bad news, and therefore some patients end up with gaps and overlaps. And so look for announcements from us about, I'll give you a preview, addictions and ending addictions, which to me would be very exciting because so many people suffer from that.
And need their tribe around them, need their family and the connections to help get them through it.
Well, we know social determinants of health matter, but we haven't been able to do anything about it.
Yeah. Alexandra, Dr. Greenhill, thank you for your time. I hope the next couple of days is fruitful for you, and thanks for coming to the Startup Health Studio.
Thank you for the invitation.
Have a wonderful time.